The COVID-19 pandemic has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to the public health, food systems, and the world of work. Coronavirus disease is a grave and infectious disease caused by severe acute respiratory syndrome to SARS-CoV-2. The disease first emerged in Wuhan, China in November 2019. Those affected are likely to develop symptoms such as fever, dry cough, and fatigue. The virus that causes COVID-19 is mainly transmitted through droplets, which means that a person can be infected by breathing in the virus and if you are within the close proximity of someone who has COVID-19, or by touching a contaminated surface and then your eyes, your nose, and your mouth. The government has taken safety measures to break down the chain of transmission by implementing lockdown and strict standard operating procedures such as wearing a mask, frequent hand washing, and physical distancing. But after over a year with the number of COVID-19 cases still rising, not only it causes economic and social disruption, but brings challenges especially to patients to attend their appointment, and also to dental students and dentists to carry out treatments for the patients. We will start off by looking into the first aspect. The global pandemic has affected most of the patients coming in for dental appointments or checkups. There are a few factors contributing to this issue. The first one is the organizational barriers. Since the movement control order implemented by our government has lasted for quite a long time, patients are expected to have delayed dental treatments due to long waiting lists. This is because the number of the patients attended per day is reduced to control physical distancing and avoid large crowds at a time. Moreover, the psychological impact also induce a significant degree of fear, anxiety, and worry, especially among elderly patients with underlying health conditions, to attend their dental appointments, as the number of COVID-19 cases keep getting worse. Due to this lockdown and strict restriction, millions of people are also at risk of extreme poverty. Without the means to earn an income during lockdowns, many are unable to feed themselves and their families, and people with poor family background being the hardest hit. The financial issues faced by patients may affect the patient's ability to pay for the cost of services needed. Another issue needs to be highlighted is transportation problems, which includes long travel distances, lack of vehicle, and adverse policies affecting travel in this COVID-19 era. However, the challenges for dental students should not be overlooked, as the global pandemic affects them greatly as well, which will be explained later by MASTURINA in the next segment.
As much as how the patients have a lot of problems during this COVID-19 pandemic, so does the dental students. As we all know, this COVID-19 pandemic had introduced us to this new norm of online learning. And at the beginning, we all found it difficult to cope. However, after a few months, I believe we all had find our way out because it is just about self-discipline in learning. However, one thing that remains a big concern is the online examination. We don't have a proper online examination procedure, and for dental school, the examinations are very strict. Therefore, they have many procedures before the exam to make sure that our setup is to comply with the golden standard of examination to prevent from cheating. And for these cases, these procedures, it had caused us a lot of stress because we are more worried about the pre-procedure process instead of the examination. Therefore, I believe that most of the students would prefer the traditional physical examination where we simply just go into the examination hall and have our exam done. Another bigger concern is our clinical requirements. As if you all know that we have a certain number of cases to be completed before we advance to the next year. And this COVID-19 pandemic had caused us to lose a lot of patients and disrupt our treatment planning. The patient had also called us something that sounds like they want to terminate their treatment because they want to go to a nearby clinic, which they don't need to have the police permission to cross the streets. And patients also called us for they are worried to come to our clinic because they are concerned about the virus transmission. Another thing that even after the lockdown had ended, some patients came back to the clinic, and for cases such as nature delivery, after a period of time, the patient teeth will shift to a new location and the arrangement will be different. So the denture that we had processed months before would no longer be fitting with the patients that come after the lockdown. And we have to start the whole procedures from the beginning. So all these problems had caused us a lot of stress, especially and being added by the standard operating procedures where the clinical sessions are limited with limited seats. We all are fighting for the limited seats, and we have to catch up with our own requirements and also be concerned about our friends. This had no ending, and it is our concern, the biggest concern right now. And another problems that we might face after this COVID-19 ended is the dental community will be aware of our limited clinical sessions. This will induce doubts among the dental community, and this will affect how we will get jobs in the future, because they will thought that we have not enough experience in clinic. However, it depends on how we look at our own challenges and problems. We also have different experience in conducting clinic in strict standard operating procedures, which is much better than the normal pre-COVID-19 clinical sessions. So it always depends on how we look at the challenges. It could be a benefit and also a hard time for us. And however, I believe that for the dental, it will be a different challenges, different from the dental student, and we will see how the dentists face the challenges in COVID-19 pandemic.
As a dentist, I am also affected by this COVID-19 pandemic. Working in the government, I received the order of having limited number of patients per day, which means I will get less number of complicated cases. This is due to the fact that the complicated procedure, like having to book the appointment first before coming to the dental clinic, make the patient do not want to come to the dental clinic. Therefore, they choose to hide the pain until it becomes severe, which is not good for the patients themselves. Each patient has their own unique cases, which a dentist can learn a lot from them. Therefore, low number of patients will cause low chances of increasing the manual dexterity skills as a dentist. Another problem that I face as a dentist is that I have an extreme fear of getting infected by the COVID-19 from my patient, despite me following the standard operative procedure strictly. When I perform the dental treatment on the patient's saliva, it will produce aerosol that might contain COVID-19 virus. If the aerosol splash onto my face, I will get infected as well. I am truly aware that few days before the patient come to the dental clinic, they have to sign in and fill in the health declaration form, which will record their signs and symptoms. However, we will never know if the patient chooses to hide their signs and symptoms and insist on coming to the dental clinic. As a result, the dentist will get infected, and the dental clinic have to be closed for sanitations, and the other dentists have to cover the work of the infected dentist. Therefore, this might lead to the dentist to have burnt out. Apart from that, I also feel extremely uncomfortable when performing dental surgery, when I have to wear the personal protective equipment suit, PPE suit. As we know, it consists of many layers of cloths to protect the dentist from getting infected by the COVID-19 virus. However, it is extremely warm that make me distracted easily. As a result, I have to put a lot of effort to maintain the same concentration while performing the dental surgery, because I do not want to make unnecessary mistakes that will jeopardize the patient's health. Therefore, as soon as I return home from the clinic, I feel extremely draining out. Last but not least, dentists that works and runs their private clinic will experience extremely high costs of maintenance of the dental instrument and also the maintenance of the disinfectants. As we know, in this COVID-19 pandemic era, we need disinfectant in order to perform infection control. Apart from that, as we all know, the dental instruments are extremely expensive, so having to couple the cost of the disinfectant together with dental instrument, this will become a big burden to the dentists. If they cannot cover this cost, this will lead to their private dental clinic to be closed, which will affect their mental health as well. Because during that era, less patient will come, therefore less income of the dentist. So having to cover all those costs will put a lot of pressure on the dentists themselves. Considering all of the factors stated above, people from all walks of life, be it patient, dental student, and dentist, they are extremely affected by this era of COVID-19. Patient oral health status and dentist and dental student mental health are of great concerns. Therefore, strategic planning and mental support must be addressed to the fullest in order to overcome these challenging issues, so that each and every one of us can grow out stronger out of this challenging event. With that, thank you.